Hey everybody, it's John. Welcome to my second video about my process of getting a PCNL. A lot's happened. Let me jump right into it. Today's Saturday. I was supposed to make this video yesterday. However, I've been in a lot of pain. Let's talk about pain for a minute. There's the kidney stone pain that we all know about. I covered that in my last video. There's a new pain. Now, you know when you're trying to sleep with a kidney stone, the position you find comfortable sleeping in is not necessarily the position that your body wants to be in. And by that I mean, sometimes I have found if I lay on my back with my legs bent and one leg crossed over the other, and then I rotate slightly, that the twisting of my abdomen lessens my kidney stone pain. But what that means, though, if I fall asleep in that position, when I wake up, it feels like my back has been crushed. So I went from about Wednesday until yesterday feeling like I had basically broken my lower back. The pain was excruciating. The nice thing was I hadn't experienced any kidney stone pain for a couple of days. But still, the pain from my lower back was excruciating, as I said. So be aware that as life progresses, you may pass or toss up the one kind of pain in favor of another kind of pain. Again, this is where you want to watch your pain meds and whatever you're doing there. I'm now 10 days out from my operation, and the instructions I have say no more pain medication, period. Tylenol, Advil, Aleve, none of that for the remaining 10 days. I'm sort of scared about that because the pain's actually to the point where I'm sweating almost all the time. Not right now, but that's another story. Anyway, so in my first video I said you wanted to stay up on the communication between you and your insurance company. And after I made that video, lo and behold, I got a phone call from the hospital. I actually got two of them. First phone call said that the insurance company wanted their own ultrasound of my kidney stone. So I scheduled that for yesterday when I went up to do my blood work. Now, it's sort of on you to keep up on all this stuff, because I'm seeing a lot of opportunities where this could really turn to shit. And by that I mean, yesterday I went up to give blood. But I was also under the impression that I needed to pee in the cup so they could check my urine to see if I had any infection in my kidneys. However, when I went to see the doctor 2 weeks ago, I peed in the cup. And lo and behold, I found out yesterday that peeing in the cup 2 weeks ago counted as my peeing in the cup yesterday. Which doesn't make sense and is a little confusing, because you'd think you'd want to know, as close to the operation as possible, what the status is of your kidneys and they're potentially having an infection or not. Anyway, whatever. So I went up to Albuquerque yesterday, and I did not have to pee in the cup. And I was a little surprised about that, and I didn't know about that until I got up there. But they did draw my blood, and then I went and had the ultrasound done. And the interesting thing was that when I asked the ultrasound technician, what do you see? She basically said that she couldn't tell me anything. And I don't know if that's because the insurance company was paying for it, or she didn't want the liability of saying, you got giant lesions or something, or what. But she basically said if it's important, somebody will let you know about it. The third and really most vital thing, though, was I had to go up and pay the deductible for my insurance policy. Now, as I said before, you want to make sure your insurance company is really on board with what you're doing, and that there's been communication between your finance department of your hospital and your insurance company. And the reason is because yesterday when we were paying this insurance, or this finance lady at the hospital, I asked her to look up the code for the procedure to see how much it would be without insurance. It's $43,000 for the procedure just to start, without insurance. So if you don't give your insurance company a heads up or make sure that the hospital is communicating with them, you may have to pay for that up front with the idea or hope of getting reimbursed after the fact. But as I said, if you don't sweat money, and that's a lot of money to you, then you want to make sure that your I's are dotted and your T's are crossed. that's about all I have for today. Today's Saturday. 10 more days to until the surgery. If you have any questions, let me know. Otherwise, maybe I'll check in once before the procedure with an update or something. See how it goes. I don't know. We'll see. It'll be relevant if I do. Anyway, John out. Leave questions. Please subscribe. Talk to you later. Bye.